Hi guys, how are you tonight? How's everybody doing today? How was work? You guys do that test I asked you to do? I bet that was fun, just asking questions. I bet they thought you was annoying them. This is Sapphire Financial Training. We do coding and billing here. This sector is study guide. Okay, this is just giving you points and clues and tricks and turns about certain things. I'll try not to be doing the reading thing from the book because I don't want to feel like I'm going word for word, but just to give you guys a couple of pointers on the anesthesia, that's what we're gonna go through today. So you know how we do here. We give motivation first. We give motivation first. Whatever you want to do it in life. I did put like a T-Pain thing on my Facebook, so you guys can look at. It's funny. He's a trip. He has like this thing where he looks at people who are like entrepreneurs and trying to do stuff, and it's fun. So I put it on there because sometimes you never know, people trying to get to another level. Like me. You trying to do your thing, but just keep up the motivation. Don't let anybody tell you cannot do something. Just go ahead and do it. Stay away from those people who do not motivate you. Just block them out and keep it moving. Just block them out and keep it moving. Many years ago, I think I was like, I don't know, 6 or 7 years old, probably was 8 years old. My father was making this motorcycle. And everybody was like, man, you can't make this motorcycle. You don't know what you're doing, XYZ. My father was so funny. I'm gonna put a picture up of him. He used to laugh at everybody. Somebody say something, all he did was laugh at him. And he made a motorcycle that was had 3 wheels on it, and he made it in the living room, and he took it apart just to take it outside, and then he took it apart again just to take it back in the house, and they told him that he couldn't do that, and he did. He showed them that he can do that. I guess that's where probably I get a lot of my creativity from. My dad, may he rest in peace. So don't let nobody tell you you can't do nothing. You know what I'm saying? Don't do that. Don't let nobody tell you that. Okay. You can do anything that you want. Okay. Again, you guys look on Amazon. Check out the book. If you get it from me, it won't be that much. Just be precarious. What's in that book can help you with your tests. What's in that book can help you with your studying. Okay, it can help you. All right. So again, keep the motivation going. You got friends and they just want to listen out. Let them listen out. I'll probably have certain days where I'm just kind of kicking it with you guys, kind of just talking to you. But that's what this class is all about. It's about inspiration and doing what you want to do. It's all about getting it where you want to get to. You have those dreams. You gotta make those dreams come to life. Forget about the people who don't believe you. Forget about them. I was talking to somebody the other day, and they was, kind of telling me, how, you pour your heart out to people, and, you don't even get a response from them, what I'm saying? But when it's vice versa, they pour their heart out to you. You're supposed to sit there and listen. You're supposed to interact. You're supposed to join in. But when you do it to them, they look at you, blank face, like, they some kind of sociopath, or, there's no expression. And I said, you know what? That's not going to change. That's the person's demeanor. What I'm saying? You can't look for something in somebody that's just not there. It's just not there. So, it's sad, but there's a lot of people out there in the world like that. And some people who are like that don't even know they like that. So, I would keep it moving. You know, I would keep it moving. You got goals, you got things that you want to talk about. Find somebody else to tell. Don't keep trying to go at the people who make you feel like crap. If that's the case, keep it moving. Okay. And don't forget, you guys send me an email. And you guys can text me too. That 203 phone number, you can text me on that phone number. You don't have to always email me. I don't care. You can do whatever you want to do. Okay. So just however you want to do it. Okay. So anesthesia, types of anesthesia. General anesthesia, drug-induced loss of consciousness. Regional anesthesia, loss of sensation in a region of the body using techniques such as spinal anesthesia, epidural anesthesia, nerve block, or local nerve block. Now, some of us are already familiar with those type of terms. If you are not, look them up. As I'm doing this, you can write it down. No problem. What I would do is, write it down and look on a computer. And you know what I would look for? A physician or surgeon actually doing the nerve block. Let's see what it looks like. You know how I am. I'm all about the visual stuff. So, monitored anesthesia care. Be careful of that one, because that one might be on your test. And remember, I am going by the CPC guidelines book by AAPC. Okay, I don't, go by any other book other than the books that I showed you, the insurance billing book, the ICD-10 CM book. I am going to do a little bit of ICD-10 PCS in my classroom for those who want to do it, but I focus on physician coding and hospital billing and physician billing. ICD-10 PCS, that's hospital, but I will give you about 5 or 10 minutes of that in the classroom. I have a girlfriend in Raleigh, and she does that all over the world. She's strictly a HEMA. She does nothing to do with AAPC. That's physician. A HEMA is more hospital coding. So she goes all over the world. I think she was at North Shore one time. I meant to ask my sister, did she know her? Anyway, see how I get thrown off? So, anesthesia providers. Listen, an anesthesia provider he's a physician. Okay, he did take a course so that he can be licensed as an anesthesiologist. Okay, it's in here. It says that anesthesiologist is a physician licensed to practice medicine and who has completed an accredited anesthesiology program. Okay, on your test, it might say, what is an anesthesiologist? you know Remember it. And in your book, if you have stuff that you are going to have a lot of issues with, write it in your book. There are pages in there for you to write down things that you may not remember. Okay, I'm not gonna go over anesthesiologist assistant. That's AA. They're like abbreviations for a certain type of anesthesiologist. Anesthesia resident who has completed his medical degree and is currently in a residency program specifically for anesthesiology training. Some of that might be on the test. What is a SRNA? A student registered nurse anesthesiast. So when you get your CPC book, which they should have came out by now, I think the 30th, all the new books should be out. So, I'm probably going to order the 220 books probably this week or next week, because I need to do everything new 220. Well, you can get, the older books, not when you take your test, but, I want to try to have the current books for you guys. I can show you, the new stuff and the changes in there. But make sure you just get the books that you need. Even if you're not in the classroom, you really literally can teach yourself. Just keep reading. Read it over and over until you oh, that's what it is. Just keep reading it. So one lung ventilation, that might be on your test. So if they say, what is OLV? One lung ventilation. Okay, one lung is ventilated and the other lung is collapsed temporarily to improve surgical access to the lung. Okay, so things like that you might have trouble on, write it down. Okay, a lot of what's in here is pertaining to cold regions, and I don't know if you guys have your book in front of you or not. When you guys know I'm coming on, you might can throw your book in front of you, but no big deal. Don't worry about it. Anesthesia is also pain management. So just be prepared to that. Acute pain diagnosis codes are separately identified in category G89 of the ICD-10 CM book. So you can look through all of those, whatever will help you. Okay. What else are we going to look at? I'm going to read this because this is that carpal tunnel procedure. And this is a procedure that I think I had mentioned before, how anesthesia is built. If you do two procedures and one is more or less than the other one, you only put the one code, but you add both the minutes, and the other one will go down as a secondary. So nerve block codes, for example, 64415 brachial plexus block, are used as an adjuncent. That's what I was telling you about, that adjuncent. It's ADJUNCT. That's connecting parts. Okay, so pay attention to that one. You don't see that one a lot. To general anesthesia, if placement is for post-operative pain management. Nerve block codes are not reported separately if the block is the mode of anesthesia for a procedure being performed. For example, if a carpal tunnel procedure is performed with an auxiliary block, a code from the anesthesia section 01810 plus related anesthesia time is reported. No separate code is reported for the auxiliary block. Okay? So, just watch that. Just watch that. And, when you guys see these things in here, I would take notes of them. Because this might be on your test. This is like something that they would more than likely put on your test. And remember, when you read the CPC guide, and this is what they have for you to study for their tests, they've got certain guidelines that they want you to go by that's in this book. Okay, so if they give you a definition for what an emergency is, and you say if somebody cut themselves and they need a death, no, whatever they have in this book, that's the definition that you're gonna choose. Don't think about it. You have to choose what they have in here. Okay. So what else we want to look at in here? So in your CPC guideline book, this book is pretty much set up. I made the medical coding Q&A book kind of similar to this one, kind of set up in the same type of way, so you guys can look at many different things. So let's look at some of the base unit values. You know what? One of these values that are in here consist of something that I did remember seeing on your test. You may not get the same thing, but there is something on the base unit values that goes step by step in here. I saw it in here somewhere. I just want to show you what it is and how it, well, I can't show you because you're not going to see it, but I can kind of give you an idea of how that thing goes. Because I remember I was saying something about the base units times something, and I pretty much was off. I couldn't really get it out. Oh, here it is. Okay, so this was what I was telling you about how they calculate payment for anesthesia. ASA, they're the ones who created those base units. That's American Society of Anesthesia. And it's on their website. And remember I told you it's on the Medicare website too, the base units. But on your test, they're going to have what the base unit is. You're going to have to do the rest. So it in the book, it says coders should understand the calculation for anesthesia service is base plus time plus physical status modifier. Now, when I say physical status modifier, let's say P1, a normal healthy patient. There's no units on that. If you go down to P4, a patient with severe systemic disease that is a constant threat to life, that's 2 units. So if they say plus physical status modifiers, that's the 2 units. Okay, plus qualifying circumstances. The qualifying circumstances, those are add-on codes to anesthesia. Let me see if I can find. Oh, here's one right here. Qualifying circumstances, that's on your test. Remember, I read that down last week. So plus 99100 is anesthesia for patient of extreme age younger than 1 year and older than 70, 1 extra unit. So if they say qualifying circumstances, that's that 1 unit. Okay, it could be any of the other ones. You might have 1, you might have 5 units. Okay, multiplied by the conversation factor. Remember I mentioned a conversation factor for non-Medicare payers. Okay, for Medicare, the calculation for anesthesia services is base plus time multiplied by the Medicare conversation factor for the region. So that is a little bit more easier with the Medicare one. But they both use the same thing, just a little tiny bit different type of method. So just be precarious about that. Also, in your coding book, you're going to see stuff in there that says, let's say you're at code 00326. There's a note in there that's going to say, do not report 00326 in conjunction together with 99100. So if you get something like that on a test and they say, well, which qualifying circumstances go with 00326, and your first answer is 99100, you know that's not it, because you already done highlighted that in your CPC book. You done made yourself a note, so you know not to pick that. Okay. I'm just kind of sliding through. I don't know why I'm getting tongue twisted or something. Moderate sedation. Moderate sedation can be provided by a physician other than the surgeon, and an anesthesiologist may provide moderate sedation in these circumstances. Moderate sedation is provided without an anesthesia machine and a backup for general anesthesia. In addition, moderate sedation codes do not include minimal sedation, deep sedation, or monitored anesthesia care. Coders are directed to the anesthesia section of CPT to report services. Only anesthesia providers report anesthesia codes. I mean, if that's a question, that would be common sense. So you know they're going to do their own codes. So let's see what else is in here. So we're just going to do this real quick. I'm not going to keep y'all forever with this one. We was long enough last week. I hope y'all got through that whole video. So I don't want to do that long thing, because we do that in class. I don't want to go through that whole thing, because that portion, then we do that in class. We do that in class too. So I'm not going to do that. Don't forget, you guys enjoy my class. Join the class. So add-on codes. Procedures commonly carried out in addition to the primary procedure performed and on codes may not be reported alone and are identified with a plus sign. Okay, you guys already know that. I'm just looking to see what might be in there. Let me give you the definition for that base unit value. Okay, which this goes more in depth. It's not just that. Okay, you got the relative value unit, all kind of stuff. So base unit value assigned to anesthesia codes for anesthetic management of surgery and diagnostic tests. Base unit values vary depending on the difficulty of the surgery or diagnostic tests, and thus the management of anesthesia. Okay, relative value unit measures used to assign a value to services, determined by assigning weight to factors such as physician work, practice, expense, and malpractice. So, keep those two in mind, because you might have something that, want to give you a couple of words on that as far as your definitions. I would put those in my book. If you think you're not going to remember that, go ahead and put it in your book, because some of those things may be in there. Anesthesia time begins when the anesthesiologist or anesthesia provider begins to prepare the patient for the induction of anesthesia, and ends when the anesthesiologist or anesthesia provider is no longer in personal attendance. Okay? So be careful with that. Be careful with that. So, don't forget, if you guys got questions, just let me know what they are. We're just doing a brief rundown. Those of you who probably listen to this, you guys already know about coding and stuff like that. We're just kind of getting the anesthesia part down. I'm probably going to mention some more about anesthesia one more time, and that's pretty much it. Oh, this is the part I was telling you guys about the time, just to kind of bring it back to you guys, because some of you haven't coded in a while, or XYZ. This is on the test. Medicare requires exact time reporting without rounding to the nearest 5 minutes. For example, if anesthesia time starts at 11:02 and the patient is turned over to PACU at 11:59, the reported anesthesia time is 57 minutes. Medicare divides the 57 minutes by 15-minute increments for a total of 3.8 units. If the procedure has a base value of 6 units, adding 3.8 units gives a total of 9.8 units, which is then multiplied by the anesthesia conversation factor for the geographic location when the services are provided. Okay? Other insurance companies may process the anesthesia time reported in increments from exact time, like Medicare, to 10, 12, and 15 minutes, or some other time increments. Now, be careful with that. On your test, they're going to give you the conversation factors or XYZ. It might be a chart in there, it might not. You probably want to take that in your book and just kind of write that down. But they're not going to give you what the regions are, the conversation factors in certain regions. I mean, they might, that's what the conversation factor is. In different states, the conversation factor is different. In New York, it would be large, in Connecticut, it would be low. So, I'm not going to say low, but just kind of be curious about that. Now, pay attention to what this say, because they put the anesthesia services and the procedure services together. They both have base units. That's okay. So pay attention to that. Okay, that's Medicare. Okay, that's Medicare. When you start working in the hospital, some of you guys work in the hospital already. You start seeing when you go into the charges, you don't see at the end. Sometimes you see the charges, the group charges, $239. You see 134.567. That's base value codes. You see that in the hospital, so you're going to see that there as well. But that's how Medicare do their charges. But we'll go into more of that, because that whole thing is like, I mean, you got to read it like 3 times to kind of get it. But you remember I told you 15 minutes increments. 21 minutes. Oh my God. Listen, I'm gonna shut this down now. I don't want y'all to get bored with my videos. But you guys make sure you have motivation. Don't forget to watch Botched. I watched that for medical terminology. And anything that kind of gets you going. Get your study guide going. Get your index cards. Anything that you need to help yourself to do what you have to do. Just go ahead and do it. Make sure you take notes. If you guys get my book, make sure you take notes in that book. There are blank pages in there, not blank, but I have line pages in there, so you can write notes and stuff down there as well. I'm gonna do another week. Probably next week we'll do anesthesia again, and then I'm probably gonna do one segment on the billing probably. Try to do it like 15 minutes. But that's what we're gonna do for then. So I'll see you guys next time. You guys got something you want to talk about? Let's talk about it. The conversation factors in the base unit. Send me something on that. Let me see how y'all doing on that. I'm gonna throw a test out there. I'm putting it on Mundo. Y'all don't know how to get in that class. Send me an email. Some of y'all got to get in the classroom from here. Cause I don't know you guys out there, but I know the ones that is in my class already. That was from before. That they do it. But if y'all kind of struggling with that, y'all kind of can't get that, or it's like, what did you say? We can go over it like step by step, because that is more than likely going to be on your test. And remember, this class is about you guys passing your CPC. We got to figure out a way to get you girls and guys passing that CPC. Let's do it. I say I'm a lot though. I'm gonna stop doing it. So you guys just tune in, every now and then. And my grandson's like, "Ma, tell people to subscribe." I mean, you can if you want to, but listen, I'm trying to give back what was given to me. So just listen. That's all you need to do. And we can go places with it, because a lot of these books and different things that I use, I want you to use too. On your lunch break, whatever, set that goal. You're going to pass that test. You're going to pass that CPC. Especially those of you in like billing and coding, when you go to college, they call it medical billing and coding. And the majority they teach you is billing. The coding, you get a little small segment and stuff like that. But the hardcore stuff, they're not going to show you. You got to teach yourself, really. And you got to take these classes, that classes. And then you got to do what I said. You remember, you got to ask questions. Ask questions. Ask. I had a coding supervisor many years ago in 2013. I don't know where she is. Her name was Michelle. I cannot think of her last name for nothing. I wish I knew what she was. She used to tell me everything. That's when I really first started, like, let's see what we're about to do here. So, find somebody, you can kind of get under their wing and look out for you. So, we all on a journey, you know that. So, again, this class is about motivation. Keep your head up, keep going. I don't care what you want to do, even if it ain't coding or medical billing. Just keep your head up and do what you got to do. Everybody have a good night. Bye.